My name is Chelsea Roberts, and I'm a urology nurse practitioner in Tuscaloosa, Alabama. And my poster presentation today is a quality improvement project called Perceived Competence and Skill of Practicing Nurses Participating in a Simulation-Based Training for Foley Catheter Placement. As we know, Foley catheters are a common acute nursing procedure with approximately 1/4 of all patients who are being hospitalized having a Foley catheter at some point during their hospitalization. A lack of mastery of this clinical skill puts patients at risk for urethral injuries, urinary tract infections, as well as adverse patient outcomes. The need was identified in my community health system for a Foley catheter training program for our practicing nurses due to consults for urethral trauma secondary to Foley catheterization. And as we know, simulation is a good training modality for us to learn clinical skills or practice clinical skills before performing them on our real life patients. The objectives of this quality improvement project was to develop and implement a skills program for nursing staff regarding Foley catheter placement, utilizing a checklist as well as a simulator to improve the competence, confidence, and perceived skill of nurses who insert Foley catheters, to decrease inadvertent urethral injuries, urinary tract infections, and adverse patient outcomes as a result of Foley catheter placement, and hopefully decrease healthcare costs, risk of litigation associated with Foley catheter placement. My project took place in the perioperative units of our health system and was coordinated with a perioperative nurse educator who were very instrumental in getting this project completed. The first thing after recruiting our participants via flyers and word of mouth was administering an anonymous pre-test survey asking some demographic questions such as, how long have you been a registered nurse? How many Foley catheters do you think you've placed in the past 12 months? Have you utilized simulation for training before? Have you used a Coude catheter before? And then 5-point Likert scale questions asking, how confident do you feel regarding Foley catheter placement in the male? How confident are you with Coude catheter placement? And how do you perceive your skill regarding Foley catheter placement? Once that was completed, then we had the participants review the checklist, which is based on hospital policy and procedure, which our hospital utilizes Lippincott for their policy and procedure manual. Once that had been reviewed, they did a hands-on simulation with a male trainer, mannequin, learning how to insert the catheter to the hub and verbalizing an output prior to inflating the balloon. We also reviewed how to utilize or insert a Coude catheter properly. We discussed catheter sizes, as well as how to prevent paraphimosis in the uncircumcised male. At that time, the participants could re-practice inserting the Coude with a regular Foley catheter, ask any questions that they may have, and then once that was completed, they completed an anonymous post survey, asking 5-point Likert scale questions again, reassessing how confident they felt after the simulation activity regarding Foley catheter placement, how confident they felt with Coude catheter placement, as well as how did they perceive their skill post-simulation activity regarding Foley catheter placement. Then we also asked them how beneficial did they feel that this activity was to their practice, and would they recommend this training to their peers. I had a total of 50 participants from perioperative areas of both community health hospitals and our health system. The statistically significant findings found that participants reported improvement in catheter placement skills post-intervention, as well as they reported increased confidence through participation post-intervention. It was found that nurses who reported less than 5 years experience as a registered nurse seemed to benefit most from the activity, with their confidence levels dramatically increasing, and it did not matter the amount of Foley catheters they have inserted. It did not affect that finding. My respondent unit experience greater than 58% of my respondents reported greater than 10% or 10 years experience as a registered nurse. 28% of my participants have inserted 1 to 5 catheters in the past 12 months. The third graph shows the perceived skill pre and post simulation, and greater than 90% of the participants felt that they were extremely skilled post simulation regarding Foley catheter placement, and 92 participants reported that the activity was extremely beneficial to their practice. implications for practice. This quality improvement project shows that there is improved knowledge, competence, and confidence in nurses regarding their ability to place a Foley catheter, that there is need for continuing training of nurses in practice, not just our new grads or our new nurses that we are onboarding to our health system, but we need to consider skills refresher course for our nurses who are already in practice, as well as it says that utilizing evidence-based practice can prevent negative patient outcomes, increases social burden as well as hospital care. There is sustainability to this project is nursing staff turnover, organization being resistant to change or adding an additional educational intervention to what they are already doing for the nurses now. Lack of funding for education in our health system, as well as uncertain simulation if this training will translate into bedside practice. Thank you for listening.